Namaskar. I'm Dr. K.K. Agarwal. With me today joins Dr. K.K. Kalra, and we are going to interact and chat with Dr. Aarti Verma, Senior Vice President Medical Quality at Max Healthcare in the city of Delhi. Welcome, Dr. Aarti.
Thank you.
Nowadays, a lot new things are happening in the field of medical science, and that's in the field of art. All over the world, people are talking about teaching the science of art to medical students. They are exploring paintings, sculptures, humanity, communications. Now, what is a patient-doctor relationship? Patient-doctor relationship is nothing but a communication. A patient may communicate by his thoughts, he may communicate by his actions. We know that if you read hypnotic science, you know that when you do visualization meditation and patient starts drawing something, and that may ultimately come out to be the state of mind of a patient. Nowadays we're talking about when you read a poetry and a painter who has painted, and you can come out the state of mind of the painter, the state of the mind of the patient. Therefore, when we come back to communication, whether it is verbal communication, non-verbal communication, it is very important for doctors to be a good actor. Every doctor has to be an actor. Remember, doctor has to follow the principles of Krishna and not Rama. We know when to speak a lie. And when speaking a lie, he has to be a good actor. And to be a good actor, you have to be a good communicator. And we have one of the best communicators with us, Dr. Aarti, we are going to interact with her on the various ways of communications. Aarti, how important is communication in today's world where we are seeing violence all over, where we are seeing disputes of patient-doctor relationships?
Yes, thank you, Dr. Agarwal, for having me over. I think communication is now we are saying that clinical skills are really worthless if they are not combined with the good communication skills of the doctor. And as you have very nicely brought out, the interaction between a patient and a doctor is, combines both the clinical skills as well as building a rapport, building a trust, and giving the patient a higher degree of experience and satisfaction, and ultimately reducing complaints. In many studies globally, it has been proven that negligence happens by doctors in about 1% even in the best of healthcare facilities. However, out of this 1%, hardly any patient is complaining. And when they analyze legal complaints, across these cases, they found that more than 70% of the cases were due to poor communication between the doctor and the patient. That led the patient to go and complain. So more than the clinical problems that did not get relieved, it was a lack of communication, lack of rapport, which led the patients to take them to court. So this has become a very, very important aspect, especially in today's world where healthcare is increasingly vulnerable to a lot of activism, to a lot of media, exposure. How we reinstate the trust with our patients is based on how we communicate with them. And communication has several aspects. It's nothing that, nobody can learn how to be a good communicator. Everybody can learn to become a better communicator. And there are small, simple facets of this which all of us can familiarize ourselves with and improve the way we treat our patients.
So when it comes to communication, I can go back to my Mahabharata era and a dialogue between Krishna and Arjun. That was an example we always remember. And the first principle of communication which Krishna taught us was patient listening. Because in the first chapter of Bhagavad Gita, Krishna doesn't utter a word.
Yes.
Is that how important that is in today?
Yes. Absolutely very well said. So I will actually look at two aspects. One is that how the doctor is giving out messages and communication. Similarly, the patient may also be doing that. So communication is a to and fro aspect of information going. And the other is how the doctor is listening to the patient. So listening becomes a very, very important aspect of communication. In the how we communicate to a patient, I'd like to stress here again, evidence has proven that there are three aspects of how we communicate. Only 7% of the impact of what I'm making is dependent on the words that come out of my mouth. And another uh, about 30 odd percent of the impact comes in the way I speak those words. So, for instance, if I were to say good afternoon, Dr. Agarwal, to you, I'm saying good afternoon. The words are good afternoon. But the tenor with which I'm saying it, if my mood is upset, if I'm impatient, I can just say good afternoon, Dr. Agarwal. Or if I'm angry from inside, there's a non-verbal way of the tone in which I'm saying it, which has a bigger impact on the person who's receiving this communication. And most important, more than this, is about 60% of our communication is the impact comes out of our non-verbal behavior. So my facial expression, the gestures I'm using with my hands, whether I'm making proper eye contact, whether my facial expression is grim or smiling or empathetic, all these actually make more of an impact on the patient than just the words that we take out. The second aspect was listening. Do we have good listening skills? A very, very important part of listening is to not interrupt the patient when they are saying something, give them a good hearing, and be empathetic, encourage them to speak out. That's also a part of good listening behavior. We find again that a lot of us, because we are more paternalistic and more the knowledge experts, we tend to presume we know what the patient is trying to explain to us and don't give them a thought. We don't try and probe, we don't try and elicit questions from them. And all these aspects can easily happen if we pay attention to our listening skills and encourage our patients to be comfortable with us, encourage them to speak out, and be very, very good listeners. Both that means we have to be very mindful, both emotionally, mentally, physically. Our non-verbal, posture that we are facing, having when we are facing the patient, how we are making eye contact, all these non-verbal cues also add up to the listening experience towards a patient.
So when we say that, this is how I experience it. When you talk about mindfulness, so we have mindfulness listening, mindfulness talking, mindfulness reading, mindfulness eating. That means all your five senses use it.
Yes.
So you when you are talking, listening, then you see how the vibrations are coming.
Yes.
Use your eyes, use your ears, use your smell, nose. So if you use all your five senses, that becomes a definition of mindfulness. A little bit I want to divert as I define aura, because when you say that sometimes you see a patient and you say you can feel his body language, you can see that he's not happy or he's not satisfied. I explain it in the level of quantum physics. In the quantum physics, at the level of quantum, when you have the photons, each photon is, qualia is your experience. Qualia is a photon with your experience. And that, there are two photons, and if they entangle with each other, they may make a bigger wave or a smaller wave. So basically, every qualia is a wave particle duality. So my wave and your wave, if they meet with each other, they may quantify or they may neutralize. It's something like you throw two stones on the water, they will make what we call them as circles. And then if two circles, if they are from the same height, the two circles will meet, it will become like a bigger wave. And if two are of a different sizes, it will neutralize it. So it is possible, and you must concentrate on that. If you are not concentrating, you will not be able to catch that aura of the patient. You may feel he's satisfied and he is not.
Very true.
Now, in High Court, when you are not satisfied with the judgment, we have to go back to the same High Court. That's the law. They never send it to another judge.
Right.
They never send it to the double bench unless the review is with the same judge. Why can't this be a law here? That if there is a, suppose patient is not satisfied, I miss these signals, Okay, why can't we all work on it that if there is a patient-doctor relationship dispute, the patient must go to the same doctor and say, "Doc, I'm not satisfied. Now you spend time with me."
Yes, very well said. And I think the doctor also never intentionally breaks the rapport and builds a mistrust. Nobody comes out with that. It happens unintentionally, and they should definitely be given a good chance to correct that. I think as the culture evolves and we have more trust and more transparency and dialogue, open dialogue between the patient, their family, and the doctors, we will have more such opportunities to revert back.
So we have around 20 minutes with us because today's webcast is going to be only 30 minutes. Let's have few tips one by one. And that's three of us, we are sitting here. Let each one of us giving tips how to communicate. And this will also be useful for youngsters. And communication is not only for the patient, but also how to communicate with the people. Let's have some tips. After everything we discuss.
All right, sure. So, I think we should have some.
The first tip you have given already. The first tip you have given is always smile.
Yeah, always smile.
That is the first tip. The first tip came is that we say service, SERVE, and S for service, E for excellent, R for responsible, SERV for value, and E for enthusiasm. That enthusiasm should be shown in your face. And Aarti, I'll tell you, I lost one business of once and worth so much. A person came to sign a deal with me from Bombay, and he was so enthusiastic. He was so excited. He was calling away, "I'm coming, doc. I'm coming, doc. I'm coming, doc." He came and he shook hand with me, and he went away.
Oh gosh, why did that happen?
He says, "आपने जो मेरे से हाथ मिलाया,
it was not
warm." He says, "The way I am excited, you are not," and I lost the deal.
This is such a wonderful example of non-verbal communication, because the way we communicate through our eyes, through our facial expressions, actually sends a very good message and about what's going on in one's internal mind. And I think when you meet a patient, every time you meet a patient, it will really, the introduction part is the most important. So how you greet a person, how you make facial contact, how you make eye contact, how you have a pleasant smile on your face, and a welcoming body language will really immediately establish a good rapport with the patient. After that, it will become much easier. So the most important part is the first 5 seconds that you're going to meet a patient when they come to see you. Is the most important.
When Rishi Munis, people used to go to Rishi Munis, they used to be very smart. They used to do their homework. So there was some technology available, whether internal or external. Internal means a D, and external means some IT technology or a quantum technology. That the time you reach, they knew everything about you, which is now possible by a Google goggles. That with a Google goggle you can go to his Facebook. Is helping us. How important it is to communicate with the patient with his name. So you are going to the patient's bed, you are going to talk to the patient. How important it is?
Very, very important. It's an excellent point you brought out. The name actually gives an identity to the human being, and you have a lot of feeling of respect when somebody calls you by your name rather than just saying this patient or that bed number. Very, very important, and a good practice is also, if you don't know the patient, to introduce yourself and also take the name, note the name of the patient and take the name of the patient each time you're interacting.
And here we at IMA have a acronym called ALERT. ALERT. A for acknowledge. So acknowledge the patient and acknowledge about yourself. L for listen and listen. E for explain and explain. R for review, have you understood? Yes. So no samjho, jano, karo. Yes. You're asking what have you understood?
Yes.
And T for thank you.
Yes.
It is not the duty of the patient to thank you. It is equally your responsibility also to tell him thanks for giving me the opportunity to treat you.
Yes. I have seen in my experience, working with some very, very famous and highly skilled doctors who also had patients literally treating them like God. So patients will be waiting outside in the OPD for them, and getting fidgety and getting impatient. And the doctor will also know that there are, say, 50 patients waiting for him outside. But when the patient enters his chamber, that time and that space is as though he has nothing else more important in his life than listening to that patient and caring for them. So that behavior is, then the patient forgets the waiting, forgets even if the doctor has to take a flight or rush to the OT within 15 minutes, the impatience is never evident on the patient. And I've seen that is one of the critical success factors of very famous doctors.
So one doctor taught me this lesson, and the lesson was that he was a resident was seeing the patient and he was jolly. And the patient asked him that why are you jolly? So he says the whole night I was working. That's not my business. I am giving you 100% fees. You have to give me 100% of your time. So if you were busy last night, some other doctor should have been there. So patient also expects 100% of us. Our time.
Yes, absolutely. So even if it is a 10-minute consult, that time is very precious, and that interaction that the doctor has with the patient and their family should be very sacrosanct. There should be no impatience or hurry being displayed at that time.
Any other tip?
Dr. Kalra would like to say something?
One of the common complaint of patient is doctor is not shown, or the healthcare staff who are providing service, they are not shown concern for our patient. So to regain this relationship between patient and doctor, be very much compassionate, provide service with empathy. Every patient wants to be treated in a personalized way and treat with empathy.
I have one other, slightly related comment. I think we need to also display a lot of respect for each other in front of our patients. And it's very important that if you're seeing a prescription written by a colleague or a doctor whom you don't know, we should never criticize that in front of the patient. Many complaints have been triggered, or many patients have turned against their treating doctor or the person who has referred the case because another colleague, another doctor has said, oh, what has he written? This medicine is not the correct one, or this test should not have been done, or you should have done another test. So we must demonstrate respect for our colleagues in front of the patient, even if we don't agree with what they have written. You can go outside and make a call to that doctor and, or tell the patient, look, I'm going to speak to this doctor and have a discussion so that we can together decide what is right for you. But please don't criticize colleagues in front of patients.
Any other tip?
Yeah, another point, especially when we prognosticate a patient, serious patient, I think we must train our young doctors how to explain prognosis. I've seen this is one of the important reasons because properly things were not explained in the condition of the patient to the families, and so much conflicts and problems arise after something goes wrong. I think every young doctor compulsory should be trained on how to explain prognosis.
There are some difficulties doctors face. We also need to understand. Okay. There are 4 types of patients. Ignorant patients. For them, they say, you take the receiver. I don't want to know anything. Then there are informed patients who are aware, this is the Google area, who have read Google and they are the one who may irritate you. And there are empowered patients who know that they can take decisions. They would like to be a decision making, they were part of the decision making. And they are enlightened patients who may be as knowledgeable as you are, who may be able to take decisions not only who may even help you in taking a decision. Doc, don't worry with that. So our level of communication will differ.
Absolutely.
And the types of patients are different. So sometimes it is an art.
Yes.
So communication is an art. Sometimes Therefore, I say that a doctor has to be an actor.
Yes. Absolutely correct, Dr. Agarwal. Although, what you said is very right, health literacy levels are very different, cultural aspects are very different. They also come in the way of, patient expectations. However, what is common to all across education, across culture, is the fact that when a person is having pain, or when the patient is having, a person is having a disease, they do have an overwhelming emotion of fear and anxiety. And I think it's for us to be very sensitive to what's going on in the emotional aspects of that patient who's come to you, and to be able to deal with it in a very empathetic manner. That's a very important aspect. We have also seen cases where patients have had very serious complications, and even errors happening, but because the doctor was caring and sensitive and had a good, trustworthy relationship, the patients swore by their doctors and believed in them and did not get upset with them. So the counter is also very important. Very, very important to deal with the emotional aspects in a very empathetic manner of, by the doctor.
So one thing which was not taught to us was religion.
Yes.
And we are supposed to, when you go to MCI, I think you are not supposed to, religion, caste, race, you have to respect. So for example, a Christian may come back and say, pray with me. Okay. I'm not aware because as a Hindu, we never pray with our patients. We may pray for the patients, but not with them. And even an Islam person may say, whatever is happening, he says, you go and time for my prayer. And sometimes we don't know this religious thing which was not taught to us. How important now is to talk about cultures, religions, race, to every doctor so that their communication is important.
Very, very important for us to understand some of the religious beliefs and cultural beliefs that people have. So, for instance, something like touch. In certain religions, touch is not accepted, whereas in other religions, an empathetic touch or a hug to a patient is an expression of empathy. Whereas in other religions, you're not meant to touch, because then they feel very offended, or it's not allowed as part of their culture. So these are the nuances. How in the sad instance, say in a hospital, a patient passes away, how the death rites are to be carried out are different in different. Some people want Ganga Jal to be given at the time of death. So it's a nice thing to start educating cultural aspects as they relate to healthcare, as they relate to situations in our system. We should know about Jehovah's Witness, which is coming up in a big way, where there is a sector of people who don't want blood transfusions because it's not the right thing. Come what happens? They say we'd rather die, but we will not give a blood transfusion because it's against our religion. So there are little things which impact of religion, which impact into healthcare, and we should be sensitized.
When we are talking about end of life issues, so that's something which is very important for dispute, because most of the people say that again the doctors or the hospital staff did not respect the dead body, the person who has died. And legally, we know it is for you that life has, you have a right to dignity. Similarly, the dead body also has the same right. And if you go back to the mythology, if you get to the Vedic sciences, till your five senses, five elements of your nature merges with the five elements of the nature, body is alive. Just because the consciousness is not there, five elements are still there. And those five elements need to be respected. That's something which is not happening because most of the time the person is chill. And one of the mistake is that when we are taught triage, when we says black means red, then we says red, yellow,
Yeah.
and then we talk about is red is the
Priorities.
priorities, green is you can wait, and black is don't. So normally in the West, black means that the subordinate, the PR departments, they take over because they have to take it down. But here triage means that means that hey, we don't even spend half a second with the relations, and that causes disputes. Specifically, when you allow relations in the emergency.
I think also the aspects of emergency, as you brought out, that doctors are quite overburdened with the number of patients they have to see, and sometimes they don't find it easy to be able to deal with the agitation or the anxiety levels of the relatives. But I think there's no going away from that. We, despite our workload, if we were to show empathy in what we do and we communicate to the relatives, the level of violence will definitely come down.
So
And
let's
then we also need to learn de-escalation techniques. You know, there's a science behind it. How do you calm down a person who's agitated? So doctors in the MBBS curriculum should be taught these communication techniques of how to de-escalate, how to deal with the end-of-life care issues, how to deal with cultural aspects. These will go a long way in helping them build their practice and being very, very effective as doctors.
So if I am a medical student and you are teaching me, teach me the 10 points. Let's end up with
Let's
that 10
summarize.
points.
Yes. So let's say that we summarize based on our discussions. One is the way we build a rapport with our patients and how we introduce ourselves in the beginning. They introduce by name and talk by name to the patient.
So first is you talk to the patient by his or her name.
Yes.
Okay, name.
Second part is how we must hone our listening skills. So we must be very good listeners, and Dr. Agarwal has also brought out very clearly.
So listen like what Krishna did to Arjuna. Listen, and listen.
Third thing is be aware of one's own non-verbal communication. How your hands are you crossing your legs and sitting, are you crossing your arms and sitting, how your eyes expression, your lips are behaving, your non-verbal communication. If you become conscious about your non-verbal communication, you will automatically start to improve it. So be aware of your non-verbal communication and focus on that when you are communicating.
So be in the present, be aware of all your five senses and be aware of the five senses of the patient and make sure they are in synchrony with each other.
Be very observant of your patient's emotional state in today's world. You know, while we are looking at the disease part, we also have to understand that there's a human being who's coming into your chamber or your ward. So be aware and sensitive to the emotional, mindful of the emotional state of that patient and try and manage that along with the clinical aspects of the patient.
Unless you are in the present, you will not concentrate on the present. Observe, and make your all five senses alert and observe, and not only observe, also anticipate what might be happening. Unless you anticipate, sometimes you may not be able to observe what is coming forward.
Although this is not linked directly communication, but I think it's also important to not forget that we must do a thorough examination. That means thorough eliciting of history and thorough examination of the patient, and keep informing about what you have found, what you're planning to do, and try and involve them in the decision making process basis their levels of understanding or their levels or their needs to question you. Be open to tell them, keep a window. Do you have any questions to ask? Do you have any doubts in what I'm explaining to you? So always try and reinforce that they have understood what you are talking.
So you need to make sure that every level you are giving, you are involving the patient, whether it's investigations. This also becomes a part of the informed consent, and so you must make sure whatever you do, you explain to the patient in his own language and review whether he has understood it well or not.
So the next course of action should also be explained, and if you want to call the patient back, be clear. So that's a proper closure of your consultation with the patient. Proper follow-up instructions, making sure they're going to come back to you with the correct feedback or the correct test report. So be very clear in what you expect them to do once they go out. Explain the medicines, explain. It takes a little time, but it is really worth it.
What happened in second chapter of Bhagavad Gita when Krishna described Arjuna in great detail? At the end of the second chapter, Arjuna got confused. And Arjuna said, "Hey, Lord Krishna, what are you saying? Sometimes you are saying, do this, do this, do this. What should I do?" So he says, "I am confused." Instead of getting angry, in the third chapter, first question, Krishna in a prasanna, the word he used is prasanna. He said in a prasanna mudra, that means he was in a smile, he said, "I was anticipating this question." So therefore, if you are communicating with your patient and the patient has not understood, he comes back to you the next day, don't get irritated.
Yes, I think it's a very tall order from all of doctors. We have to really behave in a very mature fashion. We cannot be impatient, we cannot be rude, we cannot get angry with our patients, we cannot be defensive, we can't be judgmental. Very, very tall order, but unfortunately, that's the call of the day. For in today's world, we have to be very, very nice and courteous to our patients, very compassionate towards them, especially whenever they are going through a lot of serious illnesses. So compassion cannot be taken.
Remember, we are called demigods, so we need to follow two principles of beneficence and non-beneficence. Sabka bhala aur kisi ka nuksan nahi. That purpose of our communication, verbal or non-verbal, and we also must remember that we need to follow the principles of Lord Krishna. Lord Krishna is nothing but a person with a blue skin, yellow clothes, with a bansuri, with a flute in his hand. Blue color means everything is possible. That means in medical science, everything is possible. Doctor can do wonders. Yellow means I can do it. The doctor to whom you have gone, every doctor can do it, but provided he has to have a flute in his hand. Flute means humility. Flute means that he has to. Doctor cannot work with ego. So a doctor has to be a person who is absolutely like a saint, who is egoless. And remember, people say there are so many dharmas. So I say there is only one dharma, and that is called Doctor Dharma, as far as the medical professionals are concerned, because they need to do everything with one interest: patient ka bhala ho aur uska nuksan na ho.
Practice holistic medicine, and we should also understand the limits of our expertise. If we are good at doing something, do what you are best at. Be free to refer a patient to a different level, to another colleague of yours. Be really good at what you are really good at, and so therefore understand the limits of what you can do well, and be happy to refer to a colleague if needed, and don't criticize your colleagues in front of the patients. Very, very important.
If you feel that this is part one of our communication, because when I say part one, yet more to come, not today, because communication is incomplete, cannot happen in one class. It requires multiple sessions. If you feel that this communication chapter was useful, Watch it again and again, share it, and pass it on to the people. That will be the best Guru Dakshina we can give to Dr. Aarti. Thank you, Aarti, to
Thank
be
you.
here with us.
I hope it was useful.
Yes, it was. And thank you, Dr. Kalra, to be here with us.